Hi class, this is group 4 and today we're going to be discussing Dorothy Johnson, who's one of the nursing theorists and her behavior system model. My name is Kayla and presenting with me today is Sina, Macy, Shelley, and Navdeep. So first, I just want to talk a little bit about who Dorothy Johnson was. You may not be familiar with Dorothy Johnson as with some other nursing theorist. She is not as widely known as Florence Nightingale, for example, but her work is equally as important and very much influenced by Florence Nightingale's work. Dorothy Johnson was a nurse with a Bachelor's of Science in Nursing and a Master's degree in Public Health, and she focused mostly on teaching throughout her nursing career. She was born in 1919 in Savannah, Georgia, and started her nursing career when she graduated from Armstrong Junior College in Savannah for her assistant's degree. She went on to graduate from Westervelt University in Nashville in 1942, where she received her Bachelor's of Science in Nursing, and finally went on to receive her master's degree from Harvard in 1948. She mainly focused on teaching nursing, with most of her career being stationed at Westervelt University, where she went to school. Her main focus over the years was pediatric nursing, in which she was a nursing instructor, assistant professor, and associate professor. Dorothy Johnson has published several articles of her work, including 4 books, more than 30 articles in periodicals, papers, reports, and etc. She has also received many awards over the course of her career, including the 1977 Lulu Hassenplug Distinguished Achievement Award from the California Nurses Association and the 1981 Vanderbilt University School of Nursing Award for Excellence in Nursing, among many others. Dorothy Johnson's career expanded over 29 years until she retired in 1978, and she did die at the age of 80 in 1999. Okay, so now I'm just going to talk a little bit about the behavior system model itself and the major concepts of the model. You can see here that this is a photo of the behavior model itself and how it looks like. So the behavior system model was developed in 1968 and is heavily influenced by Florence Nightingale's book Notes on Nursing. She agreed with Nightingale's belief that the first concern in nursing is with the relationship between the person who is ill and their environment, and not the illness itself. Johnson's model advocates the fostering of efficient and effective behavioral functioning in the patient to prevent illness. The patient is defined as a behavioral system composed of 7 behavioral subsystems. Each subsystem is comprised of 4 structural characteristics. An imbalance in each system results in disequilibrium. The nurse's role is to help the patient maintain his or her equilibrium. So, in terms of major concepts, there are 4 major concepts to the behavior system model. The first one is that the human being has 2 major systems, the biological and behavioral systems. The role of medicine is to focus on the biological system, while nursing's focus is on the behavioral system. Number 2 is society relates to the environment in which the patient exists. A patient's behavior is directly influenced by the environment and events that occur in the environment. Number 3 is health is a purposeful adaptive response to internal and external stimuli in order to maintain stability and control. The responses include physical, mental, emotional, and social realms. And number 4 is the primary goal of nursing is to foster equilibrium in the individual patient. One focus of nursing concerns the organized and integrated whole, but the major focus is on maintaining balance in the behavioral system during an illness in the biological system. So a behavioral system encompasses the pattern, repetitive, and purposeful ways of behaving. The behavioral system has many tasks to perform, therefore parts of the system evolve into subsystems with specialized tasks. There are 7 subsystems divided by Johnson, which are all interrelated. The first one is attachment affiliative subsystem, which is the most critical because it forms the basis for all social organization, and this system provides survival and security. There's a dependency subsystem, which promotes helping behavior that calls for a nurturing response. There's the ingestive subsystem, which serves the broad function of appetitive satisfaction and has to do with when, how, what, and how much and under what conditions we eat. The eliminative subsystem has to do with when, how, and under what conditions we eliminate. The sexual subsystem focuses on procreation and sexual gratification and begins with the development of gender role identity and includes the broad range of sex role behaviors. There is the achievement subsystem, which function is to control or mastery of an aspect of self or environment to substandard of excellence. An area of achievement behavior includes intellectual, physical, creative, mechanical, and social skills. And lastly is the aggressive protective subsystem, and the main function is protection and preservation.
So next is fundamental ideas about the theory. So the assumptions made by the theory fall into three categories. First is assumption about the system, second assumption about the structure, then third one is assumption about the function. So there are four assumptions about system. There is organization, interaction, interdependency, and integration of the parts and elements of the behaviors that go to make up the system. A system tends to achieve a balance among the various forces operating within upon it, and the patients continuously strive to maintain balance in their behavioral system by automatic adjustments and changes to the natural forces. A behavioral system which requires some measures of regularity and consistency in behavior is essential to the patient is that it has an important purpose in social life as well as for the individual. System balance reflects adjustment and adaptations that are successful in some way and to some degrees. There are also four assumptions about the structure and function of each subsystem. First, from the form the behavior takes and the consequences it achieves can be inferred what drive has been stimulated or what goal is being sought. Each individual has a predisposition to act with reference to the goal in certain ways rather than other ways, which is called a set. Each subsystem has a range of choices called a scope of action. Finally, it produces an observable outcome, which is the patient's behavior. So how does this theory or philosophy relate to the 21st century nursing practice? Johnson's theory guides nursing practice, education, and research, and it generates new ideas about nursing, and it differentiates nursing from the other health professions. Today, nurses utilize evidence-based practice. This theory stresses the importance of research-based knowledge about the effect of nursing care on the patients. Today, nursing is a different discipline or profession. By focusing on behavior rather than biology, the theory clearly differentiates nursing from medicine. As an external force, nursing causes organizing the behavior of the patients. And nursing activities aren't dependent on physician, but they are complementary for physicians' measures. So today, Johnson's behavior theory is related to the clinical environment and can be used in hospitals as a framework for diagnosis the problem of the patients and purposing and evaluation of comprehensive nursing.
My name is Sina Evans. I'm here to do the case study, client assessment, nursing intervention, and rationale. We have a case study here about Mr. James Smith. Mr. James Smith is a 65-year-old male, church leader, and a retired college professor. He and his wife, they married for 45 years. He admitted with diagnosis of severe abdominal pain with blood in the stool and dehydration. His past medical histories are diabetic, type 2 diabetic, hypertension, and atrial fibrillation. On admission, his blood pressure was 188 over 100 and his blood glucose was 10.3. He is currently on anti-diabetic, anticoagulant, antihypertensive, and anti-inflammatory. He recently had a history of CVA, which resulted in partial paralysis with numbness of right extremities, expressive aphasia, and slurred speech. Also have pain on his right arm with movement. He also completed 4 weeks of rehabilitation in support of his ambulation and ADLs. Mr. Smith has also experienced fatigue and lack of weakness and lack of appetite due to dislike of hospital food. He is also anxious about missing his orthopedic appointment, and he's anxious about being alone. He is in good spirit when family is around with him, but when they leave, he is worried. And we also have a client assessment based on Dorothy Johnson's behavioral system model. Those are achievement, attachment, aggressive, dependency, injustice, eliminative, and sexual. We'll go through each one of them. Achievement. The first one is achievement. Mr. Smith is a college professor. He's currently doing the activities of daily living, and he's learning how to do walking and other cognitive skills such as reading, writing, and speaking. And the attachment is he's also developing and maintained the interpersonal relationship with his wife and his two sons, who are very supportive, and with the frequent visit of his family and friends. And the third one is aggressive or protective. Client is very worried about nobody visiting him, and he's also worried about his wife's travels from the hospital and hospital at night, and also anxious about missing his orthopedic appointment. And the next one is the dependency. His wife took over the financial and maintenance responsibility, as he's affected with as stroke affected his mobility and his and use of his right extremities to complete ADLs, and he's also risk for fall without assistance. Ingestive is since having the stroke, Mr. Smith has no appetite, and he's also lost 20 pounds in 6 weeks and not like to take the hospital food. That resulted in decrease of intake of food. He can swallow the food, but he needs assistance in setting up the tray and feeding, as his right hand is weak and shaky. Elimination is the next subsystem, Mr. Smith is easily constipated, as he has decreased food and fluid. Also, he's able to use the urinal at bedside, but he preferred to go to the bathroom. And the last one is sexual. There is changes in the client's sexual relationship with his wife due to weakness, fatigue, and pain. The next one I am going to go through is the nursing intervention and rational. Nursing intervention and rational, also based on the subsystem. The first subsystem, according to Dorothy Johnson, it is achievement. We achieved by using clear and simple language, as the patient has expressive aphasia, and also positive reinforcement and motivation to speak. Rational for that is to enhance cooperation. The next again, we need to assist the patient muscle exercise as able or when allowed to get out of bed and doing some daily activities. Rational is the muscle exercise is to enhance sense of balance and strength of motor skills. Also provide a safe environment, as the bed such as bed in down position, and important items to closer to reach of the patient. The rational is to provide safe and secure environment that may reduce risk of fall. And the next one is emotional reassurance counseling. We provide that. The rational is to provide emotional outlet and help patient to cope up with fear and anxiety. The next system that we have, the nursing intervention, is to attachment. Assist patient to identify feelings and begin to deal with the problems. The rational is to establish therapeutic relationship. Talk to the patient and his wife the importance of stress-free environment. Rational is to avoid stress for the patient, and also to educate and determine how the patient is handling the anxiety in a positive way. Rational is to identify a positive way to resolve the current problem. The next subsystem that nursing intervention is having is an aggressive and protective subsystem. We have to explain the current situation or disease or procedure or management in a concise manner. Rationalist that may help the patient to express emotions and easily grasp the situation and feel more confidence. And the next one is dependency. Encourage ambulation when the patient is able. The rational is ambulation can decrease or reduce pressure from immobility that may lessen the factor that may related in impair skin integrity. Next one is assist the patient for RM range of motion exercise for both affected and unaffected side. Rational is this muscle exercise or range of motion can reduce muscle stiffness and spasticity which can prevent contractures. The next one is the ingestive system subsystem that we will do the abdominal assessment for abdominal pain. The rationale is to check the pain location, tenderness, bowel sound, and signs of constipation. Also encourage the patient to have adequate nutrition with fiber and hydration. The rationale is to improve consistency of stool and felicitate passage through colon. Then sixth one is the elimination subsystem. The intervention for that is monitor vital signs, intake, output, and daily weight. Rationale is to identify what is the baseline and monitor the signs of symptom and signs of anemia due to GI bleed, and also encourage fluid intake to 3000 ml per hour per day unless contraindicated indicated. Rationale is oral fluid can replace oral fluid replacement is indicated for mild fluid deficit and cost effective method for replacement therapy. Also check the color of urine and stool and record the rationale for checking those concentrated or less urine output can indicate dehydration, and melena indicate GI bleed. Monitor blood works such as CBC, GBCL, and INR as the patient has blood in stool or electrolyte imbalance due to dehydration. Rationale is to evaluate the blood loss and replacement if needed. The last one is sexual. Allow the patient to express feelings in a non-judgment way. Rational is to enhance communication and interprofessional relationship. And the next one is restorative. Administered pain medication. Rational is to manage pain and promote sleep. Introduce relaxing activities such as calm music, reading books, and relaxation technique before bedtime. Rational is relaxation activities relieves from anxiety reduction and fatigue and prepare mind and body for good to sleep.
Client goals.
Thank you.
Mr. Smith will increase strength and functions of affected right arm. Second, Mr. Smith will demonstrate behaviors that enables resumptions of activities. Third, Mr. Smith will be introduced to different techniques to enhance activity intolerance. Fourth, Mr. Smith will indicate an understanding of the communication problems. Fifth, Mr. Smith will establish method of communication in which needs can be expressed. Sixth, Mr. Smith will demonstrate knowledge on self-care management regarding his diabetes and blood pressure. Seventh, Mr. Smith will demonstrate change in eating patterns. Examples are food choices and quantity. And lastly, Mr. Smith will demonstrate understanding of his nutritional needs. Client evaluation. Within a week, Mr. Smith will show improvement on his appetite. Second, within 4 weeks, Mr. Smith will show improvement on how he can communicate. Third, within 4 weeks, Mr. Smith will show strength on his affected arm. And lastly, within 4 weeks, Mr. Smith will have a smooth transition back to his home.
I would like to conclude at the end by implementing the Johnson's behavior system model. Mr. Smith and nurses will achieve a desirable goal. This is a model of nursing care that advocates the fostering of efficient and effective behavior functioning in the patient to prevent the illness and improve health. When the behavior system has balance and stability, the individual's behavior will be purposeful, organized, and predictable. Imbalance and instability in the behavior system occur when tension and stressor affect the relationship of the subsystems or the internal and external environment. Thank you so much.